I'm a specialist in physical medicine and rehabilitation. That's my primary specialty. And while I was still working at a big rehabilitation hospital, I started seeing patients with lymphedema because the company that I worked for bought a company that also included lymphedema clinics. And I, at that point, knew nothing essentially about lymphedema. Medical schools really don't teach about lymphedema. Most doctors get little or no introduction to the lymphatic system and the disorders of the lymphatic system. So I fairly quickly had to kind of teach myself a lot about it. I went to conferences. I was fortunate enough to begin to meet some people who were very prominent in the lymphedema community worldwide, including the Foldies in Germany. And I started seeing patients, which was really the biggest impetus for me, was to start seeing patients, hear their stories, try and help them with a condition that would often go undiagnosed for years. And so I began to see more and more patients with lymphedema, and eventually left the rehabilitation hospital and established a private practice in lymphedema evaluation and management with the backing of the St. Barnabas system, which has been really helpful and really supportive. As I got more and more sort of immersed in the lymphedema world, I was seeing patients who did not seem to have lymphedema. And I became aware of lipedema as a clinical concept, and the interface between lipedema and lymphedema. The fact that many patients with lipedema start out with essentially a disorder of fatty tissue that really does not involve very much in the way of fluid in the tissues. And then as time goes on, many of those people, because of the fact that the lymphatics are often impaired in lipedema, not well supported by the connective tissue and so forth, that's many, and plus many patients with lipedema, unfortunately, ultimately develop secondary obesity. And that's a major risk factor for lymphatic, disease. Puts further stress on the lymphatics. And so many people begin as purely lipedema, which is a disorder of fatty tissue and fatty metabolism and connective tissue and so forth. And over time, sort of cross into that interface between lipedema and lymphedema. They develop swelling and many of the complications that can come with chronic lymphedema. When you see a person with pure lipedema, the tissue is soft. It's not pitting. You don't cause dents when you press on the tissue. We call that pitting edema when there's fluid in the tissues, and you can cause dents that stay there for a while after you push the tissue. I'm just pressing and holding, because sometimes if there's a little bit of fluid retention, or what we would think of as swelling or edema, if you press and hold your fingers, you can leave little dents or fingerprints or whatever. I'm really not getting that because I'm not really getting a feeling of kind of fluid in the tissues as I would with somebody who has associated lymphedema. I mean, there may be a slight difference in terms of this leg being a slightly bigger than this leg. Has that been something that you've noticed? Yeah,
I've always noticed one.
So that's always been the case.
Yeah.
Okay. There's been an enormous kind of increase in the amount of research that's been done over the last 15 to 20 years. And now many basic researchers have found that the lymphatic system is involved in all kinds of other disorders, inflammatory disorders, asthma, cardiovascular disease, cancer. So there's been a lot of basic research about the lymphatic system. We still have a long way to go. I sometimes tell my patients that we are now, in terms of the lymphatic system, maybe where the cardiovascular system was 100 years ago, before we knew about cholesterol and inflammation and cardiovascular, plaques and atherosclerosis and all those kinds of things. So we have a long way to go before we have the kind of knowledge base that other organ systems have had for 75 to 100 years. We have to thank organizations like the Susan G. Komen Foundation in the sense that they've really been behind a lot of the research regarding breast cancer-related lymphedema. Where I think we really fail still is research around other cancer-related lymphedema, gynecological cancers, melanoma, lymphoma, other metastatic cancers that may involve lymph nodes. I think primary lymphedema is really underrepresented. I think genetic forms of lymphedema don't get as much attention as they could. The numbers about the prevalence of lymphedema and also lipedema, I think, are really undercounted because it's just not diagnosed. I mean, they say that the most common cause of lymphedema in the United States is cancer-related lymphedema. I beg to disagree. I think that really relies on diagnosis, and other forms of lymphedema are just not being diagnosed. That's one type of lymphedema that most clinicians are aware of, is lymphedema after a person has lymph nodes removed or radiated. But all the other types of lymphedema and lipedema, most clinicians are not aware of, so it doesn't get diagnosed, so it doesn't get into the numbers, and it's way underrepresented in the estimates of prevalence. I think the reason that lymphedema, lymphatic disorders, and lipedema and related disorders are underdiagnosed is kind of multifaceted. One is they're not life-threatening. They don't kill people. They may be enormously distressing, and they may affect people's lives in deep and profound ways, but they're not, for the most part, life-threatening. In almost all forms of lymphedema, even aside from lipedema, where it's 99.9% women, even other forms of lymphedema are predominantly, the incidence is predominantly among females, or at least the incidence of females affected greatly outweighs the number of males who are affected. And there's a bias in medicine, and it still exists to some degree, where issues that affect women predominantly are underdiagnosed and undertreated and underrecognized and underappreciated. I think some of the disorders are associated with obesity. Lymphedema, I think one of the main contributors to lymphedema in the United States at this point is obesity. And we know we have an obesity epidemic in the United States. Lipedema obviously has a component of secondary obesity that can occur. And I think obesity is one of those conditions that still has a stigma attached to it. And many clinicians feel that it's a failure of willpower, or it's some personal failure that contributes to it. And so they tend not to take it seriously as a medical disorder. And also, probably most significantly, they don't teach it in medical school. It has essentially little or no place in the medical school curriculum. Let's face it, there's an enormous amount for every physician today to know about their own specialty. Medical knowledge has just mushroomed exponentially over the last 25 or 30 years. And so most physicians are completely immersed in trying to keep up with their own specialty. And if there's something that they never even heard about in medical school, they're just not going to be aware of it. They're not going to know it when they see it. They've never been shown what to look for. And so most clinicians look at somebody with swelling and they're like, you're swollen. It's not going to kill you. Wear some stockings, get a pump. And that's about as far as it ever goes in terms of diagnosis and treatment. And unfortunately, there's obviously some evidence that pumps can help. But as a first-line treatment, in my experience, and as a sole treatment, the problem is when patients are told, go get a pump, and they do, and it doesn't really solve their problem, they stop there. They've been told by a specialist, usually a vascular specialist, that that's the answer, and that doesn't work. Then they think, okay, that's all there is. The doctor told me to get this, it didn't work. The stockings don't fit right, because they usually go to a drugstore and get whatever they are given, and that's the end. After that, they think there's nothing else they can do, and unless they stumble across one of the few clinicians who knows about lymphedema or lipedema, that's where it stops. And some people, unfortunately, progress to really severe and irreversible skin and tissue changes and swelling that becomes completely disabling for some people. No, you never had any thyroid problems, anything like that?
No.
And have you ever had a mammogram yet, or not? No. So I see what I think of as a typical body shape for someone with lipedema. You've done a great job with weight loss. You exercise. Your skin is in excellent shape, which we often don't find with lymphedema patients, who often develop really dry, hard skin and reddening and all those kinds of things. So if there's an upside to lipedema, it's that you don't get those skin and tissue changes that are so typical of progressive, untreated lymphedema. The only interventions we really have for pure lipedema, without a lymphatic impairment component, without a fluid retention component, is intensive exercise, aggressive weight loss. And even then, that type of fatty tissue is more resistant to typical weight loss techniques. Although, I will say this, people will say, oh, it doesn't change at all. But it does. If you measure it, it changes. It doesn't, the basic disproportion between the upper body and the lower body persists. But if you actually measure the circumference when people engage in intensive exercise and aggressive weight loss, it does get smaller. You know, even in the general American public, it's very difficult to get people to exercise. All of us, myself included, should be exercising more than we do. And it's a relatively small percentage of people who really engage in regular, intensive exercise up to the recommendations of daily exercise for American individuals. So exercise does two things. It stimulates lymphatic pumping because the large muscles have an effect on the lymphatics to make them pump better. So when people engage in even just activity, because many of our patients, especially if they become secondarily obese, are very inactive. And when you're inactive, your muscles are not pumping that fluid out of there. So exercise helps with lymphatic pumping. It helps with strength and conditioning, which is good for all of us. It helps with cardiovascular fitness, which is good for all of us. And it helps with weight management. So the good news is your skin is in excellent shape. The tissue is soft. It's fatty tissue. You are doing a great job of maintaining a healthy weight insofar as you can with lipedema. And I think really continuing doing what you're doing, you probably, in my opinion, may never develop any of those issues of fluid retention and the lymphatic component of things. So you've done a great job. I would say continue doing what you're doing, and you should do well. So it was very nice to meet you.
Yeah, me too.
Take care.
Thank you.